Sego Akwesasne, I'm District Chief April Adams-Phillips, and I serve as a portfolio member for the Department of Health. It's been over 5 weeks now since the Mohawk Council of Akwesasne and the St. Regis Mohawk tribe declared a state of emergency for Akwesasne. The Department of Health has moved as much of their operations to virtual or telephone services where possible. We've been shifted into long-term maintenance mode and will be releasing updates on each sector within the Department of Health, so the community can stay informed on the current operating status and appointment procedures for each. This video will focus on the holistic health and wellness program updated on their medical clinics. Utilizing telephone triage with our nursing staff and telephone appointments with our physicians is a great move for our clinic operations at this time. This allows us to limit any potential risk for clients. If you're feeling unwell, please call the Akwesasne Medical Medical Clinic at 613-575-2341, Monday to Friday, 8 a.m. to 4 p.m. Again, take care, Akwesasne. Kanonhkwa'tsheri.
My name is Ojistoh Horn. I am a physician working here at Kanonhkwa'tsheri in St. Regis, Akwesasne. And I'm here to talk to you about some new changes that are happening or have been happening here at the clinic. As you know, because of the COVID pandemic that's been happening, we've had to make some changes with the clinic. Right now, we have a number of doctors who are working off-site, as well as myself and as well as the nurse practitioners, who can all be reached by telephone. Up until now, we haven't had a lot of people calling in because they felt that maybe their problems were not urgent. And I would like to let people know that we are available for any follow-ups of old lab tests or radiology reports or specialist reports or changes in medication, any questions at all that may not be urgent, and of course those that are urgent. We're here for any kind of question. What we really want to do is get people comfortable with this new way of communicating with your primary practitioner, so that right now is telephone inquiries. Now, if it turns out that you are quite ill or definitely do need to have a physical exam, then what we will do is make arrangements for you to be seen by myself here at the clinic, and I will suit up with my PPE and see you with a specific protocol so that we minimize the amount of contact so that we can continue with our precautions for decreasing the risk of spread of the COVID-19 virus. If you have any questions, call our secretaries either here or at the Kawehno Medical Clinic, and what we'll do is set you up for a telephone interview with myself, other doctors, or with the nurse practitioners. And so we'll continue to keep all of your care as close to the normal as possible. And of course, when things change, we will let you know about those changes. Thank you.
Hi, it's Janet Brant, nurse practitioner from the Kawehno Medical Clinic. I'm here today to talk to you about how to access the medical clinic on the island. The first thing is, if you are feeling unwell or even have a medical question or need a prescription renewal, would be to call the clinic and talk to one of our receptionists. They will do a COVID-19 screen, and then they will book you in for a telephone appointment. One of the nurse practitioners, either myself or Katelyn, will give you a call and we'll discuss your problems over the phone. Under rare circumstances, we may ask you to go to the emergency department for assessment.
If we do ask you to go to the emergency department, please keep in mind that they are screening people for COVID-19 at the emergency department, and they're keeping people separate. So your risk of catching COVID-19 and going to the emergency department is very, very low. If we do ask you to go to the emergency department, we're doing it because it is a true emergency. We're trying to keep people out of the emergency department, and that's why we're asking you to call the clinic, and we will see you over the telephone first.
We want to hear from you. We're very concerned that you're afraid to come into the clinic. We're doing everything we can to meet your health needs while we protect both of us from, that's you and I, from illness. Don't be afraid that if you call that we're going to ask you to come in. We're doing our very best to meet your needs while maintaining our distance.